This is Chapter 6, Medicare. Starting with our key terms, we have adjudication, the process of paying claims submitted or denying them after comparing the claim to benefit and coverage requirements. It's also known as a claim settlement. Also, in workers' compensation cases, it's the final determination of the issues involving settlement of a work-related accident and the rating of a case. Adjustment refers to any change to the balance due of an account, such as additional payment, partial payment, courtesy adjustment, write-off, discount, or change made to correct an error in billing or processing of a claim, such as overpayment or underpayment, or as a result of a retroactive rate charge, late charges for a previously submitted bill. Advance Beneficiary Notice of Non-Coverage, also known as an ABN. An agreement given to the patient to read and sign before rendering a service if the participating physician thinks it may be denied for payment because of medical necessity or limitation of liability by Medicare. The patient agrees to pay for the service, also known as a waiver of liability agreement or responsibility statement. APM, Advance Alternative Payment Model, a system for medical reimbursement that provides additional compensation as an incentive for the delivery of high quality and more cost-efficient healthcare by providers. Approved charges, a fee that Medicare decides the medical service is worth, which may or may not be the same as the amount billed. The patient may or may not be responsible for the difference. Crossover claim, a bill for services rendered to a patient receiving benefits simultaneously from Medicare and Medicaid or from Medicare and a Medigap plan. Medicare pays first and then determines the amount of unmet Medicare deductible and coinsurance to be paid by the secondary insurance carrier. The claim is automatically transferred electronically to the secondary insurance carrier for additional payment. It's also known as claims transfer. Disabled. For purposes of enrollment under Medicare, individuals younger than 65 years of age who have been entitled to disability benefits under the Social Security Act or the Railroad Retirement System for at least 24 months are considered disabled and are entitled to Medicare. Donut hole, a temporary limit on what a Medicare drug will pay. The coverage gap begins after the patient and the drug plan together have spent a certain amount for covered drugs. DME, durable medical equipment, any equipment that provides therapeutic benefits to a patient in need because of certain medical conditions or illnesses. ESRD, end-stage renal disease. Individuals who have chronic kidney disease requiring dialysis or kidney transplant are considered to have ESRD. To qualify for Medicare coverage, an individual must be fully or currently insured under Social Security or the Railroad Retirement System, or be the dependent of an insured person. Eligibility for Medicare coverage begins with the third month after beginning a course of renal dialysis. Coverage may commence sooner if the patient participates in a self-care dialysis training program or receives a kidney transplant without dialysis. Formulary is a list of drugs that a health insurance plan covers as a benefit. Hospice, a public agency or private organization primarily engaged in providing pain relief, symptom management, and supportive services to terminally ill patients and their families in their own homes or in a home-like center. Hospital insurance, a program providing basic protection against the costs of hospital and related after-hospital services for individuals eligible under the Medicare program, known as Medicare Part A. Assignment, a transfer after an event insured against, or an individual's legal right to collect an amount payable under an insurance contract. When related to Medicare, this is an agreement in which a patient assigns the right to receive payment from the Medicare administrative contractor to the physician. Under this agreement, the physician must agree to accept 80% of the allowed amount as payment in full, once the deductible has been met. For TRICARE, providers who accept assignment agree to accept 75 or 80% of the TRICARE allowable charge as the full fee, collecting the deductible and 20 or 25% of the allowable charge from the patient. With other carriers, accepting assignment means that in return for payment of the claim, the provider accepts the terms of the contract between the patient and carrier. Beneficiaries, individuals entitled to receive insurance policy or government program healthcare benefits, also known as participant, subscriber, dependent, enrollee, or member. Benefit period. A period of time during which payments for Medicare inpatient hospital benefits are available. A benefit period begins on the first day an enrollee is given inpatient hospital care, nursing care, or rehabilitation services by a qualified provider and ends when the enrollee has not been an inpatient for 60 consecutive days. Also, in workers' compensation cases, the maximum amount of time that benefits will be paid to the injured or ill persons for the disability. For disability insurance, the maximum amount of time that benefits will be paid to the injured or ill persons for a disability. CMS, Centers for Medicare and Medicaid Services, formerly known as the Healthcare Financing Administration, or HCFA. CMS divides responsibilities among three divisions: the Center for Medicare Management, the Center for Beneficiary Choices, and the Center for Medicaid and State Operations. Correct Coding Initiative, or CCI. Federal legislation that attempts to eliminate unbundling or other inappropriate reporting of procedural codes for professional medical services rendered to patients. Jurisdiction, a defined geographical area over which a Medicare administrative contractor oversees processing of claims. Limiting charge, a percentage limit on fees specified by legislation that non-participating physicians may bill Medicare beneficiaries above the fee schedule amount. LCD, local coverage determination. Decisions made by a Medicare contractor that are developed to decide whether to cover a particular service in accordance with CMS's definition of what is medically necessary and to provide coverage information for medical services. LCDs are only applicable to that Medicare contractor's jurisdiction. Medical necessity, the performance of services and procedures that are consistent with the diagnosis in accordance with standards of good medical practice, performed at the proper level, and provided in the most appropriate setting. Medical necessity must be established via diagnostic or other information presented on the individual claim under consideration before the carrier may make payment. Medicaid, a federally aided, state-operated, and state-administered program that provides medical benefits for certain low-income persons in need of health and medical care.